Well, I'm here with extraordinaire Mark Shropshire. This guy knows more about rehab, movement, movement assessment than anybody I know. So without further ado, I know you're involved with something called original strength, which
I
restores
am.
movement patterns and resets your nervous system to unlock your full potential.
Mhm.
Why don't you take the baton and tell everybody what it is, how it started, and how you utilize it?
Well, why don't we start with where it started? And
Great.
for me, that was through a relationship that I had with another trainer, who was probably one of the most skeptical people I've ever met in my entire life, in a good way. He's got a very, very thick filter for all things, and I knew that if this guy was on board with with original strength, that there must be something to it. And so he invited me to a workshop where I met I guess the authors of Original Strength, or the guys that kind of were bringing this to the masses. A guy named Tim Anderson, and at the time another gentleman named Jeff Newpert, and they put on this fantastic workshop of movement restoration. And I knew within about 20 to 30 minutes of listening to these guys talk and experiencing, because it was an experiential workshop, it wasn't a slideshow or anything like that. You got up and you did it. Within about 20 to 30 minutes, I knew that I could use this system of movement restoration with every single client that I ever had, and would have ever, from my mother, who was a retired music teacher, to my professional athletes, to some of the tier one operators that I was working with, to high school kids and college athletes, to lay people, because it was just the simple basis, the foundation of movement, right? And if movement is movement, like movement to me, the best way it was described to me is like a squat to you and I is the exact same, more or less, movement pattern as it is for a professional athlete, right? It's just you're triple extending and triple flexing three major joints, your ankle and your hip, more or less, to lower down and stand back up. So if that's the case, well, then professional athletes know they'd probably just do a little bit more of it, a little heavier, a little faster, and my mother would just like to be able to stand up out of a chair and be able to get down with grace and fluidity. But the patterns of movement are still the same. It's just how we load them and how frequently we do it, and for what's our desired goal. So listening to Jeff and listening to Tim talk and experiencing this, I knew I was on to something pretty good. And so I started using it right away with a lot of my clients with great success.
Great.
And where Tim kind of came across this was actually, he was at the point in time in his life, he was kind of a mover and a shaker in the kettlebell world. And we all have these little communities of people and things, right? And Tim was kind of a guy in that community, but behind the scenes, he was always hurt and in pain. He could do amazing things with bells and kettlebells. He's in fantastic shape, but he's always hurt. And Tim looked for and tried pretty much everything from dry needling to massage to foam rolling to Graston, myofascial work, trigger point release, whatever it was. He pretty much tried everything. And at one point he was reading a book, and the book talked about this thing called the neurodevelopmental movement sequence, right? Which is basically something that researchers, we take a look at how human beings go from basically an organism that's laying there, and how does this little baby figure out how to get up and stand and walk up on 2 feet and move. We don't have movement coaches. It's just sort of this innate program that we all have. And so, Tim thought about it for a little while, and he's like, you know what, I'm going to give it a shot. And so he laid down, and I believe he did some diaphragmatic breathing, just kind of looked at the book, said, okay, well, I'll try this. Moved his head up and down a little bit, left and right, like an infant kind of does, following their parents around the room, and got back up, and he instantly felt better. And he's like, wow, this is kind of strange. But if you think about it, Rob, what we're doing is we're kind of going back to the very foundations of human movement. So what do we do, like, if we forget, like if we have let's just say, unfortunately, a stroke victim or something like that, we'll use that as an example. And we're trying to reteach that individual how to speak and how to move. Well, we don't start out like teaching somebody how to speak again by sticking, Tolstoy in front of them and having them read War and Peace, in Russian, something super complex, and then translate that into Mandarin Chinese. we start with the simple foundations of the language, vowel sounds, consonant sounds. And then we put those things back together to teach people how to speak again. Well, the same thing happens with movement. Right. And that's what original strength really is it goes back to the foundations of human movement, okay, which is we start out as most people, most children do, obligate nasal breathers. Okay? Obligate diaphragmatic breathing. What does that mean? That's our design. The doctor doesn't whisper to us, hey, psst, breathe with your diaphragm. It's better that way. This is just something that innately happens. It's a pre-programmed blueprint in the nervous system of everybody. And more or less, all human beings kind of go through this neurodevelopmental movement sequence, okay? To varying degrees, obviously, because we're all different. We all have different environments. But it's going through that neurodevelopmental sequence that sets us up for being able to go from laying on our backs to laying on our bellies, to being able to push ourselves up off the floor, then to be able to kind of rock back and forth, okay? Usually we're trying to get to something, but we haven't quite figured out how to get there. To then being able to crawl. We figure out how to move our arms and move our legs in some sort of unison. It's a little ugly at first, but that's because we don't have a fully developed motor control center in the brain that coordinates nice, smooth movement. Our little cerebellums, our basal ganglia, they're not communicating with the rest of the body really well, but they're learning. And then we go to be able to do that, to be able to be seated, and then to stand up, and then eventually to walk. Well, how does that all happen? Okay. And it happens through roughly going through this neurodevelopmental movement sequence that sets up the foundation of something called the gait pattern, walking, okay? Which is kind of, what I believe, and a lot of people within the original strength community believe is kind of the ultimate design of the human body is to go through the gait pattern and to move. So once I understood that, and once I understood how to apply all of that, it just opened up a new window of training. It's now basically the foundation of everything I do, from movement restoration to, I'm not a physical therapist, so I don't work with people in pain. I typically refer out. But if there's little aches and pains here, like some on my back, my shoulder feels a little tweaky, we can use some of these different concepts to get the body moving the way it was designed to move. And oftentimes these little aches and pains kind of seem to just go away when the body's moving authentically the way it should.
So original strength.
Yeah.
Restoration, not rehab. Going back to base movements, which, when you really think about it, you made a real salient point. Our parents hold our hands and they help us walk, but they really don't train the way we move. They don't teach us how to nod the head. And I do have a big question on nodding of the head. Yeah. So it's basic ideas. Diaphragmatic breathing, which is critical. You want people to be a belly breather, not a mouth breather. It's much more effective. Yes. So let me ask you a question, because you said about nodding of the head up and down. So it's flexion and extension. They stimulate different muscles. Mm-hmm. Could you clarify that and really signify that? Because that's a great little tool for exercise. I even watch people who squat, heavy squats, and that's not what we're talking about, but that's ultimately where you want to build somebody to. They'll look straight ahead if they're squatting. They drop down, they get weaker. If they look their eyes up, they get stronger. Explain that pattern and how the eyes really activate the muscle patterns.
Certainly. So in original strength, or just basically in human movement, the eyes, we say the eyes lead the head, and the eyes and the head will lead the body in movement. And we all kind of know this, like where your eyes and your head go, the rest of the body goes. Like Dr. Rob, if I ask you to turn your head to the left or to the right, to turn around and look behind you, the rest of the body is going to follow. So for example, if I'm going to turn my head this way, right, you notice my shoulder moves. I don't move my shoulder and then drag my head through. If I look up, okay, if I was to give you a side profile, look up, my spine is going to extend. If I look down, my spine is going to go into flexion and rotation as well. So the eyes, in leading the movement, the eyes are actually connected to the some proprioceptors at the cervical spine level in the back of the neck, and they're very finely tuned to the slightest bit of movement. I think it's like 0.4 of a degree. Right. So if you're sitting there just barely moving, you are keenly aware of that. Okay, and why would that be? Well, for one, it's protective mechanism. So our bodies and our brain really wants to know where our head is oriented over our bodies, right? So as we move, up and down, we're getting all this rich sensory information as to where our head is going in relation to the rest of the body, and the body's going to move in it, accordingly. So when we're small children, okay, and we have this large, oversized head on the ground, and we need to move this thing, okay, by sitting there, we don't quite have the strength yet to pick our heads up off the floor, but we can tuck our chins. Okay? We can tuck our chins. And what's happening here is we're starting to develop the reflexive core of the body. Okay. So this is, human movement, like good human movement is based off of reflexes, okay, which is without conscious thought. So these two little muscles underneath the chin, which are critical to good anterior chain or core development, called longus colli and longus capitis, get turned on when we're laying on the ground and we're tucking our chin forward. Okay. And I think it was Paul Chek, who was one of the kind of
Correct.
big guys way back in the day. He was way ahead of his time back in the, I think, early 90s when I first heard of Paul and his work, talked about the flexures of the neck being the top of the core, the top of the anterior chain. And at that point in time, we were, it's like, ah, he's crazy, he doesn't know what he's talking about. Well, 30 years later,
He's a genius.
Found out he's a genius. Yeah, he was dead on right with a lot of things, actually. So anyway, with eyes and head moving at an infantile level, we're going back to the ABCs of movement, which is head control. Okay? Eye and head control, and starts with being able to move your eyes, okay? Which starts the whole process of maintaining head control. And it's through good head control and through good eye control that the rest of them, and good diaphragmatic breathing, that sort of sets the foundation for everything else. It's almost like you start with a small ball of twine, kind of wrapping it around it, or an onion rather, and you start building up all these layers on top of it. Well, if that center core isn't dialed in and isn't solid, everything else around it is going to be weaker. It's sort of like a wiffle ball versus a baseball. And in human movement, that solid core of the baseball is what we refer to as the 5 big resets, which is, one is diaphragmatic breathing, head control, okay, rolling, being able to roll from your belly to your back and belly back to belly, rocking back and forth, and then contralateral movement, or the gait pattern, which starts with crawling. Right?
Yeah, I want to get in on that. First of all, great point about longus colli, longus capitis, because when they're working, the cues work well. However, most people have their longus capitis and longus colli stretched out because we suffer from interior head posture. So already they're not getting the proper feed to their head. And as we know, our head is like a bowling ball. It's, 9 to 12 pounds, but for every inch that it's forward, it's an exponential increase of pressure on the neck cascading down through the body. But really, you just gave the unwritten truth, is the lack of feed from the head to the brain. So, wow, huge takeaway. So I want to reiterate those 5 resets: diaphragmatic breathing, head nodding, if I could use that, rolling, rocking, crawling, and crawling, cross-crawling.
Yeah.
So can you break those down just a little bit for everybody?
Sure. So we typically will start out with diaphragmatic breathing first. As children, we're obligate nasal breathers. Okay, and there's a whole host of benefits to breathing nasally, and inspiration in and out through the nose. In original strength, we tend to try to keep people's jaws closed with the tongue at the roof of their mouth. So the tongue sits here, right at the roof of the mouth, right in the top row of teeth. And we do that because there's specialized receptor cells in the tip of the tongue that are also connected to your vestibular system.
Great point.
Okay? So when the tongue is here at the roof of the mouth, behind that, a couple things are happening. One, it's good for jaw development. Okay. So as children, the bones are still soft and growing. So when we have the sucking reflex, when we're feeding, we're developing the formation of the bones of the jaw, okay, which also helps develop good sinus cavities. Okay. And every time we're doing that diaphragmatic breath, that's core training 101. So the diaphragm is not necessarily a respiratory muscle, which it most certainly is, but it's also a core stabilizer. And because of its neurologic and fascial connections to the pelvic floor, muscles of the pelvic floor, and some muscles around the center of the body called the transverse abdominal wall, and the multifidi up and down the body, we're starting to turn those things on, and it starts with diaphragmatic breathing. And so what we also know in movement science is that muscles that are stretched and pulled, okay, which when you diaphragmatically breathe, everything kind of will, your belly will expand and then drop down and exhale. We're starting to gently pull and tug and activate and turn on those muscles. So a muscle that gets stretched is also neurologically an active muscle to the brain. And that starts with diaphragmatic breathing. So
that is critical takeaway, in that people who can diaphragmatic breathe, which most people can't. My patients can't when they come in. Your clients' patients can't when they come to see you. But what you just did was you elucidate a clear way of understanding that without diaphragmatic breathing, your core is not going to activate appropriately. And with lack of core, you're going to have a decrease in proprioception. So you're showing how all these patterns work together because the body's all interconnected. This is exciting.
Yeah, there's nothing about you that isn't connected some way to another part of you. Like how we breathe affects how we think. Okay, how we think then affects how we move, and how we move is based on our outward expression of the health of our nervous system. So that's there. Everything here is working together. It's not like, well, I do diaphragmatic breathing for this, I'm going to do strength training for this, I'm going to do no. Everything is interwoven together. Yeah, that's where it's studied in little pockets and pieces because it's easier to study it and understand it that way. But the connecting of the dots and how the different parts of the body all work together so that we live a good, vibrant life, that's kind of sometimes the missing part. And so, but everything starts with breath work. I don't know if you've ever seen this, like I think it's called a pyramid or a hierarchy of physiology.
Mm-hmm.
Like, what is the stuff we need to do to live? First and foremost on there is breathing, followed by circulation. Okay. So being the very first and last thing we're ever going to do in this world is take a breath. And we take that thing for granted. And so the most fundamental thing to life, if that is breath, and it is, okay? And if you don't believe me, hold your breath for about 3 minutes. You're going to figure out that we get very uncomfortable without that.
You're going to get a headache. Yeah.
We might as well learn how to do this well. And, people way before me and way before Original Strength have been investigating the effect of breath work on the human body. So it's either the biggest smoke and mirror job sold to mankind, or there might be something to it. And there's definitely something to it.
Can you share how to do proper diaphragmatic breathing? Because everybody's going to ask.
Sure.
Could you do something? Because they're all going to ask right now, like, okay, I'm in. What do I do?
So it's very simple, as everything should be. It's a simple process of, we want to keep the jaw closed, but not tight. We're not clenching down. Just put your teeth together. Place the tongue at the roof of your mouth, and if you're not sure where that is, if you just make the consonant sound N, like like as in Nancy, and where that tongue goes there, that's where your tongue should be placed. Then when we inhale, we want to inhale in through the nose, and it's gently, just a gentle inhale. And then a gentle exhale. It's slow and easy.
Feels good.
Yeah. And when we take this breath, the belly should expand. Okay. And so it's kind of, you breathe from the bottom of the lungs up. What we don't want to do typically is to breathe up here and be an apex breather. Okay, where you're, or
like many people,
to be a mouth breather. There's some great books out there on the benefits of breathing and how mouth breathing it's a bad habit to get into for a whole host of reasons. It affects your hormonal levels chronically. Of course, if I take a couple mouth breaths because I'm huffing and puffing while I'm on the rower, that's not going to be the end of it all. But if you're a chronic mouth breather, okay, if you're always kind of low grade, that's a sign of stress to the body. It's a low grade sign of stress to the body. You're also off gassing a lot of carbon dioxide, which if you go back to the Bohr equation, I think it's the Bohr principle, Bohr equation, I can't remember what it's called. You need carbon dioxide in the body to have an efficient exchange of oxygen with the rest of the tissues. So if you're always off gassing too much carbon dioxide, hemoglobin's affinity for oxygen increases and it wants to hang on to it. Right? Another good benefit of breathing in and out through the nose, besides the diaphragmatic breathing, the movement capacity that we're talking about, is you also conserve carbon dioxide. Okay, you conserve it, and you're also stimulating the production of something called nitric oxide. There's specialized cells up inside the nasal cavity, which the nasal cavity, and I also believe the veins of the body, or maybe it might be the arteries, can't recall, but those are the only areas that we know of right now that produce this wonderful gas called nitric oxide, which is the vasodilator, okay? And it helps arteries and veins expand and improves blood flow. So not only are you stimulating, number one, breathing on that hierarchy of physiology, but by producing nitric oxide, you're also helping with circulation, the second level of things that we need to live as human beings. So ton of great things going on with diaphragmatic breathing outside of we're going to make our core start to function reflexively a little bit better.
I want to layer to what you said. Neurologically, utilizing the diaphragm utilizes the phrenic nerve. Phrenic nerve, cervical 3, 4, 5, keeps the diaphragm alive. But the phrenic nerve works in concert, believe it or not, for certain actions with the vagus nerve, which is a hot nerve conversation. Cranial nerve number 10 goes from the brainstem down through the transverse colon. And that helps with breathing. So now you're getting a systematic effect. If you're able to positively affect the vagus nerve through breathing, you're now able to stimulate your parasympathetic nervous system and have a better rest and digest system and a more homeostasis between your sympathetic and your parasympathetic nervous system, all layered from teaching somebody the basic concept of how to breathe appropriately. So now if we could couple that with, like you said, the head nods, the rolling and the rocking. Let's see what it takes us.
That's a great point. I'm glad you brought that up. Is that being the diaphragmatic breathing sets the nervous system more into a parasympathetic state. Okay, so that we're not always in a low grade fight or flight. And that happens a lot with mouth breathing. Okay, and so these states aren't just all one or all the other. They are regular. Even the simple process of breathing, when you inhale, it tends to kind of tickle the sympathetic side of the nervous system. When you exhale, it tickles the parasympathetic side, right? So an inhale is like, think about when you get frightened. Somebody scares you. What do? You don't go, you don't yawn and exhale. It's a sudden rapid inhale, right? So, and then when you're relieved of that stress, you exhale. So good diaphragmatic breathing also tends to kind of push that neurologic needle, more in the direction of parasympathetic, a rest and digest, regenerative state. And it also helps with relaxation of muscles, decreases muscle guarding. The next layer then on top of that then is head control or nodding or rotation. Okay. And to a child, and the reason why this is like core training 101, that the child's head on average is about 33% or so of its total body weight. So to put that in perspective, I'm about 205 pounds. So for me, if you can imagine that, I would have about a 60-ish pound head. And how aware of, I think you made reference to 12 to 16 pounds right now as an adult, something like that. Okay. And we're kind of used to it. If you've ever played football or had headgear on, all of a sudden you're very aware of where your head is because of that extra weight. Well, to a child or to an adult, if I made my head 60 pounds and maybe about a quarter of my total body mass, I have this massive head, almost this alien head sitting on top of here. Okay. So for a child to be able to pick that big thing up off the ground, okay, they have to do it mechanically correctly, which is chin tuck and up here. And they use that big head as a lever. Okay. And if you just sit upright tall and you turn your head and you're just aware of the muscles turning on in your core by moving your head in all these different directions, you will feel the muscles of your core responding to head movement. Okay? And this is what a child does, is those muscles respond to the information coming to them from the central nervous system, from the sensory uptake of moving the head around it. And in addition, then the child is strengthening the muscles of the neck, strengthening the muscles of the core. And we know this, if you just lay down right now on the ground and you pick your head up to look at your toes, you'll feel your core reflexively contract. Okay? If you flipped over on your belly and you pick your head up to look up at the ceiling or look at the horizon, you'll feel the muscles in the posterior chain all turn on. And this all happens without conscious thought. This is a reflex, okay? Which stability of the human body is based off of reflexes. And so what original strength is really doing here, it's a little bit more than strength training. It's we're stimulating and we're kind of cleaning up all the sensory information, the sensory information that comes up into the brain, and we're improving that sensory uptake so we get a better outtake. So better information coming in, better, we'll call it outformation going back out. So the body responds. And that loop just happens over and over and over and over again. So by learning good head control, okay, that's just now another layer of reflexive core stability that the body needs. So the body needs to have its central pillar stable so that the appendages, the arms and the legs, can operate well off of it. So it starts out laying on the belly and we look up and around, okay? And it's usually just because we're this little organism that's gaining sensory information, looking around, okay? So while that might be the case, we're also strengthening all these muscles in preparation for all the other cool things that we're going to do, which is rolling over, the ability to roll over, okay? And why is that important? Well, when we start moving our eyes and moving our head, we're crossing midline. And when you cross the midline of the human body, you start to connect the left and the right hemispheres of the brain together through a little structure called your corpus callosum. That's like a superhighway, the Autobahn of neurologic information, okay? So when these two things are starting to work, okay, my right half of my brain starts to control the movement on the left side of the body and the left side through here, like a little X. And if you look at the human body, it's full of these little X connections, right side to left side to right side, anterior, posterior, all over the place. So when we're starting to do this, we're starting to move our head across midline and being able to move and starting to roll. That rolling is actually the beginning of the human gait pattern because it starts to connect one side of the body to the other. And the human gait pattern is contralateral movement, but it starts with head control and moving across that midline. So
Contralateral movement, critical concept. I do it all the time in my rehab setting in my office because, as you said so articulately, each side of the brain is now communicating. You're getting the crosstalk through that corpus callosum, and you're interlocking all the lobes of the brain. Interesting. So a great example of that would be walking, running, high-level exercise like swimming. So it's very interesting how you're tying together, cross-crawling, and which is really based on proprioception. So cross-crawling is the ability to have one side of the body do an opposite action than the other side. Just think of a swim, just think of a stroke. In addition to that, proprioception is your balance of your, holding your core so you can move, like you said, your appenditures. So now you've got all these different type of systems, and people don't realize a lot of this based on, you said in your brain, but it's really your head. Your head is a feed for information to your brain, which is that computer chip.
Yeah.
Lastly, and I think I'd love you to expand on this, you talked about stability versus mobility. I'm going to throw the idea of flexibility in there. So if you go through what they are, how they interchange, and what they mean and how to train for them, I think our listeners would be quite well informed.
All right. Well, I'm going to just tell you that I don't believe in flexibility.
That's all right.
I don't think it exists for the simple reason is that we look at what the purpose of muscles is, and we've, people way smarter than me that have a ton more initials behind their name have done the work. How do we classify different types of muscles? Well, we got fast twitch and slow twitch, type A, type B, satellite, all this different stuff, right? All these different ways to classify muscles. Well, another more simple way to kind of look at different muscles is by what are they supposed to do, right? And so in the human body, at least when I look at it through the lens of original strength, I look at muscles that are designed to stabilize joints, right? And muscles that are designed to move joints. Right? So the muscles that stabilize joints, they have a very low threshold to fire, okay? And they'll fire all day long, okay? Muscles that move joints have a little higher threshold to fire, especially our fast twitch fibers, okay? So, if you take a look like your muscles in your shoulder, they're also these muscles that move joints are also very superficial. You can see them quite easily. Whereas the muscles that stabilize it, those are a little bit deeper, more proximal to the joint itself. Okay. Well, in human movement, if we don't have these reflexive stabilizers of joints turning on right away, well, something else has to do its job. And the human body craves stability over mobility any day of the week. It wants to be safe, right? And so you can kind of take a look at the human brain and the nervous system as almost inhibitory or protective. The brain wants to keep itself safe. Okay? That's why it's encapsulated inside this large thing called the skull and amongst other things. So when we're looking at human movement and flexibility and stability and mobility, well, stability and mobility are this interwoven dance that kind of work together. And we don't have a great term to kind of describe that. And I think it was maybe Gary Gray and Vern Gambetta back in the day when they were doing a lot of their teaching on functional movement. Right. I think they came up with the term of most stability, right? Which is kind of this hybrid of mobility and stability together. So understanding that the human body wants to be stable above everything else, if those reflexive stabilizers of a joint aren't doing their job or they're late to the movement party, they should be the first guy there and the last guy to leave, okay, to the movement party. Then all the other guests kind of come after them. But if they're late to the party, they're not working, or if they're just dysfunctional through disuse, through like a process called neural pruning, we don't use it, we lose it. The body's going to recruit some other muscle group close to that joint to stabilize it. Well, and oftentimes this is going to be a mover of muscles that move joints. Okay? And we're going to get beyond like prime movers and assist, secondary movers and things like that, but they're going to move the joint. So an easy one to look at is the hamstrings. Okay. People say my hamstrings are always tight. Hamstrings are tight. I can't touch my toes, yada, yada, yada. And I'm like, all right, well, first off, if you tell yourself that enough times, your body tends to believe it. Okay? I've seen, well, we're going to do a toe touch. Well, I haven't touched my toes in years. Oh boy, this is going to be awful. And so they set the stage for it. And then what do? They start to bend over and you hear this. And my gosh, you're bending over to touch your toes, but you're acting like you got like 500 pounds on your back. All right. So I watched that. And I said, and sure enough, they can't touch their toes and they feel this tremendous stretch in their hamstrings. Well, the body wants to stabilize itself in any movement that it does. And this is kind of the funky thing is that it would be great if the hamstrings were tight all the time, regardless of what we did, but they're just not. But for a lot of people, the hamstrings get tight in a toe touch. I said, all right, let's take a look at you. So we'll lay down the ground. We'll have you lift your leg up. Okay. And the other leg will just kind of be down here on the floor like that. Okay. Or we'll put both feet up like that. And you'll see the muscles be shaking. There'll be legs like that. And all right, well, pick your head up and look at your thighs. Okay. And so going back to what we talked about earlier, when you pick your head up off the ground, you get a reflexive contraction of your core. Well, suddenly those hamstrings loosen up and the leg can be lifted up a little further. Well, gosh, why is that? That doesn't even make sense. If you think about, we're pulling forward like this, we're tightening up the posterior chain, right? All those muscles from the back of the neck down through your erector spinae, back to the glutes and the hamstrings, part of that posterior chain, that should be getting tighter because we are now pulling, but yet the hamstrings allow better movement. So that begs the question, are the hamstrings actually tight, or are they being used to substitute as a pelvic stabilizer or a hip stabilizer when the muscles around the hip joint or the pelvic floor themselves aren't doing their job? So the body goes, well, I got to be stable somehow, and it's going to it'll pick the hamstrings, or it'll pick the lower back. Right? So by adding good core reflexive stability, just by picking the head up, now those hamstrings can go, oh, okay, I don't have to stabilize the pelvis any longer, and I can, or the hip joint anymore, and now I can go back to being a joint mover. And all these other muscles that are supposed to stabilize my pelvis or my spine or the lumbopelvic complex, they're doing their job now. So the hamstrings can just loosen up. Okay. So, and another thing is that sometimes people, they work their hamstrings. And so that fatigue feels like tension to them. And that's the only word that they use to ascribe to it. So they use, my hamstrings are tight. Well, they're just hyper stable. That's how I look at it. And they're being used for the wrong job. And the histochemical nature of the hamstring is not one for long endurance stability work. It's just not. And so because that muscle gets used too much for a job that it's not designed to do, it'll feel tight. And we have tight hamstrings, or we have inflexibility, when largely it's just the reflexive core of the body and the reflexive muscles around the lumbopelvic region, the hip, aren't doing their job. So the brain picks something else.
Thank you. Thank you. I every patient walks in and says they have tight hamstrings. They just do. And I tell them virtually the exact same thing. It's a break in a mechanism, and it's typically your core is not engaging. And the core is a great example of stability to allow for mobility.
Yes.
A break in mobility will lead to a break in stability. A break in stability leads to a break in mobility. And that's proprioception. And there is no tight hamstring, like you said. The hamstring is actually lengthened. To take it one step further, it's long. So when somebody's lying on their back and they see their leg and you lift it up, it's like taking a rubber band and stretching it out. When you lift the rubber band up, it won't go as far. But when you engage the core, you shorten the rubber band and make it at its right tensile length and strength. Then you lift it up, and it's going to have appropriate range of motion. As Yonder once said, he who treats the side of pain is lost. You and I like to say, he who treats the side of area of dysfunction is totally lost.
Yeah, you're not going to find the answer there. So if you kind of go, if you're looking for like the answers in movement discrepancies, if you go back to the basic foundations of human movement, a lot of times you'll find your answer there. And that's a great. This is a simple, easy discussion on how proper reflexive stability of the body leads to improved movement, which leads to an upregulation of strength. So kind of take this into the weight room. If your body is not stable, okay, and because of a lack of stability, it now becomes immobile. Well, your brain is going to down-regulate the amount of neural input into the prime movers to lift stuff. Okay, so if you are trying to get stronger in the weight room and you're not stable, reflexively stable through your core, your body is going to choose stability over getting jacked any day of the week. And you're not going to be able to express yourself in movement as well as you possibly could if you had these basic foundations down. And I'll take this a step further, Dr. Rob. One of my very best friends was a Navy SEAL. Okay? He's now retired. And I was in the Army Reserve. And so there was great banter going back and forth. I played for the JV team and he was on the All-Star team, which he was right. Okay. And he said, you know what, Mark, one of the biggest differences between you and I is, and I said, well, I'm handsome and you're not. And that was obvious. He said, besides that point was that in the special operations community, in the military, we're experts at the basics. And I never forgot that. And I was like, you're right, because he was an expert at land navigation. He was an expert marksman. He was a diver. Obviously, he was a Navy SEAL in the water. He was expert at a lot of things. And when you're expert at a lot of things and the basics of anything, the complex things are easier. You can solve complex. If you understand mathematics really well at its basic foundation, complex mathematics become easier. If you understand human movement at its very basic core, complex human movement becomes simpler to dissect and to fix or to improve. So and that's what original strength really is. It's just getting the basics down and refining them over and over and over and over so that you don't think about things. They just sort of happen naturally now. And that's kind of the cool thing. We've seen people like, I haven't touched my toes in, God, I can't remember how long. And we have them lay on their back and do diaphragmatic breathing for 2 minutes, have them stand up and they touch their toes, or their range of motion improved by like 3 or 4 inches. Or if bending over, squatting and hurt their back, they're like, oh my God, I feel good. And you can just see their body, their whole demeanor changes because they feel good. And that's one of the things that Tim always says is that it feels good to feel good.
Right.
And when you feel good and when you move good and you feel good, you tend to project goodness out into the world. And so then you can affect a lot of other people. And that's one of the things that we say in OS is that we're going to change the world through movement, good movement. So when people feel good about how they move and how they feel, it's a lot easier for them to project goodness out into those around them and into the world and start to change things that way. So that's a little bit more esoteric than we maybe need to get into, but it's true.
Great stuff. I love the fact that you have a screen. I love movement assessment because I believe that movement tells a human being's whole injury story.
It does.
And movement never lies. It's the baseline for what we do. So you can assess, you can treat, and you can reassess based on movement. It is quite, in my opinion, objective, even though people argue it is subjective. I believe that every manual practitioner should incorporate some form of a movement screen, even if it's just watching the patient walk when they walk in your office or your facility. Sit to stand, mimics a squat, as you had said earlier. And I do believe that every patient and every practitioner will benefit from this communication, because that's what movement is, communication. That said, let me ask you some of the more bigger misconceptions in the fitness industry right now. Well,
Sure.
I think everybody's going to know your answer, so try not to blow a cork. Stretching fixes everything.
No, I mean, that's God, if I had a nickel for every time somebody said I don't know, my knee hurts or my back hurts, what kind of stretch should I do? Like, who ordained stretching as the best thing we could ever do? That doesn't mean that we shouldn't ever stretch, because sometimes stretching just feels good. And if it feels good, sometimes you can interrupt that pain sequence in the brain and allows better movement to come. So I sometimes stretching isn't always the best thing to do. Can it be a part of what we do to improve movement? Sure. Does it feel good a lot of times? Absolutely. Okay, well, that's not the worst thing you ever did. But if you understand the underpinnings of human movement, okay, which is reflexive stability, and reflexive stability, if you can make people more reflexively stable, a lot of these little aches and pains, they just go away because now the body is moving better. Okay. There's better fluidity between the movement of the femur and the pelvis and the spine and the pelvis and how that all works together. So when we're reflexively tied together, okay, when this side of the brain is communicating with this side of the brain and this shoulder is communicating with this hip in human movement, basic human movement, like in a cross crawl, all this stuff just kind of goes away. These aches and pains go away. The movement feels better. And typically I would take a look at one of the best examples I had was a gentleman that I worked with for a while who came to me he was post-rehab and he had a frozen shoulder, right? And they'd done some work on him and he could maybe get his arm, about here. He was still out in front, anterior. And we got him down on the floor. And why on the floor? Because the floor is safe. You don't have to worry about balance so much. And he played along. He was a good sport about it. And we had him do some diaphragmatic breathing and got him back up and he moved a little bit better. And he said, all right, what else you got? So we did some head nods. We did start looking around and we did rocking back and forth. And rocking is very gentle, reflexive stability training or activation for your rotator cuff for a lot of different reasons. Then we had him get down and rock on his forearms. Okay. Got up and his arm went from here, you can see this, to straight up over his head. And he hadn't been able to do that for a good couple of years. And so right away, I did like 3 things. It took us about 5 minutes. And his range of motion had improved more than it had in the last couple of years of physical therapy.
Great.
And, he's like, how did you do that? How did you know? And I just kind of connected a few dots. We downregulated your sympathetic drive through diaphragmatic breathing. Okay, made you feel comfortable. We started moving the head around. Okay, a lot of rotation. What is it? Your scapulas will retract. Okay, when you turn and you rotate. Okay, we're starting to mobilize your thoracic spine through head movement. Okay, and then we're going to rock back and forth, which turns on your rotator cuff and the scapular stabilizers with your head up, which promotes extension. And we need extension of the spine to get optimal range of motion through the shoulder. So just kind of connecting all those little different dots, you're like, okay, well, now it just starts to make sense with how you start to work with these simple underpinnings of human movement to fix bigger issues.
I knew you would love that question. I'm going to hit you with one more before I leave you.
Yes, sir.
If you look good, you're healthy, You presumably know what you're talking about because you got great abs, veins in your biceps.
Yeah, not always the case. I think, this might be a conversation for another podcast.
Yeah.
Would be I think, again, bring it back, Paul Chek's name, what's he call them? They're the healthy sick. Okay, where they look very fit, but they're very sick underneath. They're basically people prop themselves up with a ton of supplements, steroids, things like that, and these people become influencers. I've seen people even go so far as to use fake weights for like all these little like weightlifting stunts. And if you go on Amazon and you type in fake weight plates, you can find styrofoam weight plates that people will use to make themselves look like they can squat, or press 315 pounds over their head and all this ridiculousness. But yeah, being fit and being healthy is more than looking jacked. That can be a part of it, certainly. But some of the strongest people I know don't look like that at all. But they are extremely dialed in. Okay, their hips and their shoulders work together very well. Their reflexive strength is really dialed in, and these guys can perform amazing feats of strength and endurance because of that. And so, yeah, having muscles that show versus muscles that go.
Yeah,
I'm going to pick muscles that go.
I love it.
Any day of the week.
I love it. I love the go muscles, not the show muscles. It's a term we used with endearment many, many, many times. Look, this has been great. I was happy I could get you on. I know you're a busy guy. They're going to be able to contact you how?
So if you want to get a hold of me, I have a website and you can contact me there. It's just markshropshire.com. Through Instagram, it's at Shropshire ST. It looks like Shropshire Est. But it's just my last name, Shropshire ST. And I get plenty of interaction for people that way.
Great.
Or you can just simply email me, and my email address I think is on my website. Contact me through those are my two primary spaces that I interact with people. So, Dr. Rob, I really appreciate it.
My pleasure. The man who's got a black belt in Taekwondo, right? Got a
Yes,
black
I do.
belt in Taekwondo. Got a couple of books that you're working on right now. Got a couple of apps. You help your wife with work. Right?
I do. Yeah, I got a few irons in the fire.
Right. You're a busy guy. You are without question a champion and an original strength. And
thank you.
Just an absolute pleasure to deal with. Just an absolute pleasure.
Yeah, this has been great, Dr. Rob. I hope we can do it again sometime soon. I've really enjoyed this.
You're on the list.
Appreciate it. Have a great day.
You too now.